Hey there, so in this video we're going to talk about hypercalcemia. So first off, we're going to talk about why is calcium important. Calcium is going to affect the excitability of nerve and muscle cells. The two electrolytes that are going to be important in these are going to be calcium and potassium. Each cell is going to have a threshold and a resting membrane potential for the nerve and muscle cells. So when the threshold is equal to the resting membrane potential is when the cell is going to fire. The calcium is going to impact the threshold. So if the threshold is closer to the resting membrane potential, then those cells are going to be more likely to fire, whether that's a nerve cell or a muscle cell. Hypercalcemia is going to shift that threshold away from the resting membrane potential and therefore make cells less excitable and less likely to take any action. Resting membrane potential and threshold are based on the different concentrations of calcium and potassium, both on the inside and the outside of the cell. So when you're in a hypercalcemic state, the threshold is going to be further away from the resting membrane potential and therefore make it harder for the cells to actually take any action. The causes of hypercalcemia include decreased renal elimination of calcium via renal insufficiency, an increased GI absorption, increased reabsorption of calcium from bone, and that's going to be in hyperparathyroidism, and you can also see hypercalcemia in malignancies. The values of calcium that are going to be considered normal is anywhere from 8.6 to 10.3 milligrams per deciliter, and that's in the conventional units. You may see slightly different numbers depending on where you're looking, or 2.2 to 2.6 millimoles per liter, and that's in the SI units. That is for the serum calcium, and that's going to be the total amount of calcium in the body. Whereas if you look at the ionized calcium, which is just calcium that's not bound to any proteins, that's going to be 4.4 to 5.2 in the conventional units, and 1.1 to 1.3 in the SI units. Again, ionized calcium is calcium that's not bound to proteins, so it's free and able to exert actions. The signs and symptoms of hypercalcemia include loss of deep tendon reflexes, lethargy, hypotonia. Those all make sense, right? Because your threshold is further away from your resting membrane potential, so it's going to be less likely to take any actions, less likely for there to be any reflexes, and because of that, you can think of them as tired. Nausea and vomiting is also a sign and symptom, and then EKG changes that you're going to see are a shortened ST and QT interval. The treatment for hypercalcemia includes volume resuscitation with normal saline or increased PO intake to 3 to 4 liters per day. You can also give loop diuretics. You're going to want to avoid thiazide diuretics as they are going to increase calcium reabsorption. And if the underlying cause is hyperparathyroidism, which is leading to increased bone reabsorption, then you can try calcitonin. And that's it for hypercalcemia. If you have any questions, feel free to leave them in the comments.